since there are hundreds of no more, we demand that mental health clinics be reopened. We demand more resources for the institutions that already offer those services. We demand more resources to be able to offer long-term treatment.
Hello, my name is Diane Adams. I'm on the right board with the City for Mental Health. I'm on the board of Southside Together Organized Crime. I'm a volunteer for the mental health movement. The reason I'm here today is to let y'all know that mental health is very important. For me, in '96, I had lost my son. In '98, I tried to commit suicide. 2005, I was in a coma. I was out of commission for a year. And because of I came to the city, I found me a therapist and taught me my medicine and about my illness. And at that time, I started to make goals for myself. And I accomplished all of my goals. But the problem is now that we want the city to be accountable for these last 5 centers we had. Because when we came to the city in 2011, we told the mayor, if you close these centers, there were going to be suicide, there going to be people displaced, people that get shots, and then they don't want to, when the psychiatrist retired, they don't want to replace it. When the therapist retired, they won't replace it. We're asking them to fully staff these clinics, because when we came to the mayor in 2011, we had 28 aldermen was in agreement to help us try to keep the closure of the center. But when the mayor stood up and said, I got 50 aldermen, only 25, they reneged on us. Now when we had one that stepped up, she was sorry for it. Now I am happy that we have these here now to help us with this task force, because we really need it. It's very important. Because I'm not asking y'all them to be strong like me. Because when I came in the system, I was just there. But now, look at me now. I'm talking to y'all. I'm on the board. So I know what it'll do for you. So let's all come together. Let's make this happen. It took us 6 years to get here. 6 years, so help us with this. Thank you.
I think that's a great point to end on. Let's all come together. But if you have some questions, we'd be happy to take those now.
If I can ask. Blue ribbon studies are often where major issues go to die. What is going to make this study something that will provoke action as opposed to just sitting up on a shelf where they can say, well, you know, we have a study that shows we need more?
Yeah.
So I think a couple of things. I think you've got the voice of almost all the aldermen in the city council. We understand what we're seeing in our wards. We understand the implications of what happens when we don't take care of our most neediest people. We're seeing the manifestation of that in different ways in our jails, on our streets, in our homeless population, and we can't be short-sighted about how to deal with it. So we are going to deal with it. We are forcing ourselves to deal with it within a certain time period, to come back with a budget and recommendations. And quite frankly, this is the way we should approach all major issues in our city.
Do you think the result will likely be that there will be, at some point, more clinics open in the city of Chicago?
So I think we're going to take an open look at that, and we want to put together a task force of people who understand this issue to come to bring recommendations back to us, including opening clinics again, and possibly not. We really want a holistic look at where we are right now at this place in time, and a guidance of how to move forward so that we have a healthy city.
As Ms. Adams said, in 2011 there were 28 aldermen who signed on to keep the clinics open and then went back on that promise and the clinics were closed like why now? Why 6 years later? Where was this 6 years ago?
Right. So as all of you know, I wasn't here and I can't speak to the math, and I don't. A couple of my colleagues would like to speak to that. Chairman Mitz.
Thank you. And yes, I was one who signed on 6 years ago in support of closing clinics as we were looking to find ways of balancing budgets and shortfalls. At the same time, I can tell you I knew it wasn't something and deep in my heart that I knew it should be done. But at the same time, I'm just one council, so I took and sought the advice of other colleagues. Maybe you can go along with others. Now I see, I should have stood on my first stand.
Yes, yes.
Today I will stand and tell the world. Mental illness is not something that we can look down on. I'll tell you what I told the mayor then. When you do it to the least of these, you've done it unto me. Because I have mental illness in my family, and mental illness comes from many different sources and factors. It could be trauma from a loss of loved ones. It could be one have had a hardship, fell into a mental illness. And for some of mine, it could be accident that occurred. Things that were beyond their control. And we have to have a society to care about folks who have lost loved ones, maybe fell on hard time, felt that they need to do drugs or medication, cause a problem. These are problems that we're dealing with today, and they're not going anywhere, and we have to take care of the least of these. This is our first and foremost call as elected officials, as a citizen in this city of Chicago, to help those who cannot help themselves.
Are you saying that you are not stepping up because of the political and the elections that each of you all face in each of this 20th ward, the 8th ward, you aldermen in the 5th ward, you Emmett Mitz, you all have never stood up to demand and to fight the mayor. Most of you all vote with the mayor 99.5% of the time. Alderman Boyes, we've been asking for this. So is it because you're trying to reach out to your constituents to have them vote for you? Because Ronald Jackson back there, he's been asking you, demanding you all not to close the facility.
So I think a number of aldermen would like to answer that. I would just like to say that, it's important that when you make decisions, that you're able to look at yourself and reassess where you are at any given point in time. Anyone who's not able to do that, should not be in a leadership position. Decisions are hard. They're hard to make at different points in time, but it's important to always reassess those decisions, and I think that's what we're doing now. Alderman Kaplan?
Sure. I was one of those aldermen that voted for that. I'll give you a bit of a background for me. When I was 15 years old, my dad committed suicide. That left my mom raising 8 kids by herself. I later became a social worker. I specialized in mental health, specifically because of the trauma it caused my family. Unfortunately, mental illness, there's oftentimes a genetic component to it. So there is mental illness in my family. So this is a very, very serious thing for me. I live in the community of Uptown. The community of Uptown has the highest per capita rate of people living with chronic mental illness in the United States of America. There is no other community that has more mental illness. So this is very, very important for me. At the time we voted on this, we were told that a lot of these people getting care were going to get their care at a lot of not-for-profits and federally qualified health centers, and there's 255 of them. However, I think now is a very good time to make that assessment. What is the wait time for these individuals? Because I and all of us demand that people get the mental health care they need. It causes trauma. We also want to know what clinics have waiting lists. I want to know, for those people who are undocumented, who don't have any access to health insurance, how do they get their health care? Is there a delay? And this assessment's going to give us that needed information so we can make an informed decision. Any vote that we do, there's always negative repercussions, and there's positive repercussions. We want to step back and look at the positives and the negatives, and is it time to make a tweak in this? And I'm very open to doing that because I'm very focused on addressing mental illness. I have a very personal issue with this.
Okay, and so.
If there's
We're gonna wrap it
anyone,
up now.
pardon me, if there's anyone who has not asked a question, we have time for just one more. Otherwise,
Any other-
we need to get to the
Yeah, any other questions?
Mental illness, and she's a bipolar patient. I dealt with mental illness all my life. And the clinic on 87th and Constance was closed where she received treatment at. And the clinic at Jackson Park Hospital was closed where my mom received treatment at. And so this deeply affects me. That's why I'm here, because I'm speaking on behalf of my mom.
My daddy
that
bipolar.
We
suffered from that.
thank you for being here. We're going to go into committee now and address some of these issues in more detail, so thank you all for coming out. Thank you.